Peace and good teacher and peace and good classmates. The topic of the day is managing COVID-19 in general practice. The majority of you must be tired of listening all the news about COVID-19. Today I'm going to inform you more about this, but specifically on how to manage COVID-19 in general practice. It's important so we don't believe everything we see on the internet and we can all be well informed about what's happening to our world. What is a coronavirus? Coronaviruses are a large family of novel enveloped RNA beta coronaviruses that usually cause mild to moderate upper respiratory tract illnesses in humans. Hundreds of different coronaviruses have been identified, which mainly circulate among animals. The most recently discovered coronavirus, SARS-CoV-2, causes coronavirus disease COVID-19. It emerged in Wuhan, China in December 2019 and spread rapidly across the globe within weeks. So how is COVID-19 transmitted? The basic reproduction number for SARS-CoV-2 is estimated to be between 2 and 3, which means that each infected individual will on average transmit infection to 2 or 3 others. Therefore, it's important to stay more than 1 meter away from a person who is sick. In an analysis of COVID-19 cases in China, there were no cases reported to have occurred through airborne transmission. The most common symptoms of COVID-19 are fever, respiratory illness, and dry cough. Some people become infected but do not develop any symptoms at all. About 1 in 6 people develop a serious illness and have trouble breathing. The risk and severity of the disease increase with age and in respiratory and cardiovascular diseases. In the largest study of 75,000 cases in China, 1% were asymptomatic, 81% had mild illness, 14% had severe illness, and 5% were critical. Remote assessment in general practice. The two main types are telephone consultation, which can be used for both triage and assessment. Video consultation when visual cues and a therapeutic presence is required. What happens if the possible infected shows up? Isolating a room with the door closed and window open. It's recommended to wear a fluid-resistant surgical mask. Communicate preferably by phone or a conversation to close the door. And once the patient has left, they have to follow a controlled guidance for cleaning the room. Social distancing guidance. It's a set of measures taken to reduce social interaction between people in order to reduce the transmission. Vulnerable individuals, including anyone over 70, pregnant women, and anyone under 70 with underlying medical conditions, are advised to follow social distancing more strictly. Management advice for patients on home isolation. Anyone with a new continuous cough, fever, or flu-like illness must stay indoors for 7 days from the date of onset of symptoms. They are advised to stay at least 2 meters away from vulnerable individuals and have food, medication, and supplies delivered to their home. What can we do to protect ourselves? Wash our hands and use alcohol-based disinfectant to kill viruses that might be on them. Keep a minimum distance of 1 meter between you and anyone who coughs or sneezes. It might contain the virus. Avoid touching your face, since your hands touch many surfaces and can pick up the viruses. Stay home if you're not feeling well. If you have symptoms, seek medical attention and call ahead. This will also help prevent the spread of viruses and other infections. Is there a vaccine, medicine, or treatment for COVID-19? To date, there is no specific vaccine or antiviral medication to prevent or treat COVID. However, possible vaccines and different specific pharmacological treatments are being investigated. There are ongoing clinical trials to test them. The World Health Organization is coordinating efforts to develop vaccines and drugs to prevent and treat COVID-19. Can patients get reinfected with the novel coronavirus? The vast majority of those who get COVID-19 and recover will develop antibodies against the virus, protecting against further infections by the same virus and provide long-term immunity. However, they don't know how long the immunity to the virus will last for and how much antibody we need to protect against reinfection. Overall, on current evidence, reinfection is likely to be very uncommon. Thank you for listening.